Hi, everybody. I see that there's a bunch of people who've joined us. Welcome to Wine, Women, and Hormones. We're so excited that you could join us today. We have a very special doctor that we're going to talk about or talk with today, Dr. Aliza Cicerone. She happens to be in my neighborhood, so a lot of my neighbors head down to Spark Health to see Dr. Cicerone for all of their health needs. So I'm very excited to have Dr. Cicerone on Wine, Women, and Hormones today. If you haven't joined us for a Wine, Women, and Hormones, I'd be happy to tell you that this is your time. No question's a dumb question. If you have a question, please put your question in the chat and we'll make sure it gets answered. This time is for you. This is totally educational. I'm Deb Hubers. I'm one of the co-founders of Levita Compounding Pharmacy. And I've been very happy to be involved in working with healthy aging and naturopathic and integrative medicine for the last 13 years as Levita. I'm also a huge fan of naturopathic doctors. I'm on the board of trustees of Bastyr University, which is one of the best naturopathic medical schools in the world. And so what I'd like to do is I would like to introduce Dr. Aliza Cicerone, and we'll get started with the Wine, Women, and Hormones.
Thanks, Deb. Hi, everyone. I'm excited to be here. This is one of my favorite events that I get to do. And, you know, we're used to doing it in person, but it's been really fun over Zoom too. And I think a great way to engage, get your questions answered. You know, like Deb said, there are no stupid questions. This is a time for education and we only know what we know. And it's a great opportunity to learn more about bioidentical hormones, learn about healthy aging, and make sure that you're kind of living your best life and you're your best version of you as we move forward. So please ask any questions. We're happy to answer them. And we will share all of the information we've got with you. So we'll get going. Okay, so, you know, I think one of the things that is so important with menopause, and I see so many of my patients that come into me with this, is they feel like something's a little off, but they don't know what exactly that is. And this is where we're able to discover what's going on. We like to joke about our 7 menopausal dwarfs, right? Everything that women tend to go through with perimenopause and menopause. So we've got sweaty, itchy, bitchy, sleepy, forgetful, psycho, and bloated. Many of us are some of those things, you know, all through, but not necessarily just now. But, you know, you're definitely not alone. We're here to help. We're here to answer questions. And, you know, life can be back to what we considered normal again. There's no reason to have to deal with symptoms that feel foreign to you and make you feel not great. There are answers, and this is all totally modifiable. One of my friends who's a nurse the other day just said, you know, we don't have to have wrinkles. There are things we can do about it, you know? And I feel that way about, you know, about hormones too and healthy aging. It's not something that we're stuck with without solutions. There are plenty of solutions. And what I love so much about Levita is they have the best, most high quality solutions. We're going to talk all about that. Okay. So, you know, one of the things that I have discussions about with my patients all the time is perimenopause versus menopause. And perimenopause is so different for so many women, and the symptom picture can be, you know, vastly different. So perimenopause can begin around age 35, some women a little earlier, some women a little later, and can last up to 15 years. 10 to 15 years is the average for women. So it's not like all of a sudden, you know, the light flip, like switches, right? The switch flips. It's just something that can happen over a period of time. Some people experience symptoms throughout that time, some people don't, but it's just our different hormone levels that are changing. And our hormone levels, as we move towards menopause from perimenopause, our hormone levels start to drop. And that can bring on a slew of symptoms for people. And we're going to talk about those, but, you know, insomnia, weight gain, hot flashes, and they can be mild, they can be severe. It totally runs the gamut for all different types of women and all different types of symptoms. So that's the really important part about working with a doctor that's well-versed in anti-aging and bioidentical hormone replacement, is that they know what to do specifically for you. And I think that's the most important piece there. This is all individualized to what each patient needs. It is not a one size fits all prescription or treatment plan. So let's talk about bioidentical hormones. A lot of times we hear about hormone replacement therapy, HRT. And in this context, we always talk about bioidentical hormone replacement therapy, BHRT. And I find, as a naturopathic doctor and integrative oncologist, that the bioidentical hormones to me are really the safest, most effective way to enable women to participate in hormone replacement therapy. So our bioidentical hormones, the molecular structure is absolutely identical to our own hormones that we're making. The hormones are naturally sourced, and then Levita customizes the dosing through compounding. So at a conventional pharmacy, you only get what the manufacturer makes, right? You don't have any say in the different strengths and the different dosing capabilities. Whereas a compounding pharmacy like Levita, the doctors and the pharmacists have 100% control to really make your compounded medication exactly what it needs to be for you. So we can change dosing, we can change combinations, and we can make it so it's really the most effective for each individual patient, which is the piece I really love. All the medicine that we do is personalized medicine. So to me, it really gives each patient a truly individualized approach. So let's talk about our different types of hormones, because I think this is something we hear all about, and different doctors prescribe in different ways. And I think the main thing that we hear about with menopause and that we talk about and doctors talk about is estrogen. Estrogen is a super, super important hormone in our body. It's a really important hormone really all through adolescence and puberty, all the way through menopause. There are over 400 different bodily functions that it participates in. It regulates body temperature, which is so important for hot flashes and temperature regulation. It really does help with insulin sensitivity, so making sure that our blood sugar is balanced well, and that our cells are actually sensitive to that insulin and responding to it well. It plays a really important role in sleep, as does progesterone, which we'll talk about. And we notice a lot of women in perimenopause and menopause do start having issues with insomnia and some sleep issues. And estrogen is really important for cardiovascular function. It's very cardioprotective, and is a really important piece in actually what studies are continuing to show. It's a really important piece in minimizing the risk of cardiovascular events as well. I think it's so important from a cardiovascular perspective because it keeps our arteries nice and elastic. So we don't want to have hard, stiff arteries. We want them to be nice and bendy and fluid and elastic, and it really does help with that as well. It does a similar thing in skin also, right? It helps us make collagen in our skin, which helps our skin stay nice and supple and elastic so that we don't have, kind of thick, harder, tougher skin. Keeps it really nice and soft and supple. And it does play a role in cognitive function as well, with maintaining memory, both short and long-term memory. I could say like our mental clarity, our focus, our concentration. Estrogen does play a big role in that too. And it does increase sex drive. It does really help with libido and sex drive, again, in combination with other hormones like testosterone. And what I think is so important is it really does help maintain bone density. And as women age, we can have decreases in bone density, which can lead to osteopenia and osteoporosis. And estrogen is a huge player in maintaining those healthy, strong bones. Of course, along with weight-bearing exercise and healthy diet and nutrition, but estrogen is a big piece of that as well. So let's talk about different types of estrogen, because estrogen is not just estrogen. There are different types of estrogen. Some are more harmful and some are more beneficial. So our big type of estrogen in our body, our most abundant form, is estradiol. We call it E2, so the di for two, E2. Estradiol is really, the mainstay for estrogen in terms of all of the functionality of estrogen in the body. It's what controls hot flashes and controls night sweats, so really helps with that temperature regulation, supports healthy heart and circulatory system, and supports cardiovascular health. Really important for our cognitive function, our memory, and this is the key one that plays a role in bone density as well. And it does help with maintaining that beautiful skin that we talked about. So estradiol is one of the big players in terms of estrogen. Estradiol, E3, 3 for tri, T-R-I. This is a not highly potent estrogen, and it's actually protective against breast cancer, which is really important to me as an integrative oncologist. The biggest thing that I think when we're talking about hormone replacement therapy, HRT, versus bioidentical hormone replacement, BHRT, is that conventional hormone replacement therapy does not contain estriol. So the Vivelle, the Clamara, the Minvel, all of the different patches, estrace, all the different creams that you can get commercially, from Walgreens or CVS or Rite Aid, they do not have any estriol in them. So you're missing out on all of the protection against breast cancer. You can only get estriol with a compounding pharmacy. And how we do it when we compound it, the doctor and the pharmacist work together and they do a combination of estradiol and estriol together. So you get the potent activity of estradiol and you get that really protective activity of the estriol. And most combination estrogen creams are actually predominantly estriol with a little bit of estradiol mixed in there. So you have a lot of protective benefit with that estriol as well. And it helps with protecting your estrogen levels too. So progesterone is our other female hormone that we think about a lot with menopause that tends to fall. Even before menopause, our hormones are fluctuating all throughout the month. And so people notice before menopause, with perimenopause, as they're moving into menopause, that they might have issues as the progesterone and estrogen fluctuate throughout the month too. One of the things I notice the most is when my progesterone falls before I get my period, I don't sleep as well because as progesterone is so important helping with sleep. It's really important for balancing your mood, balancing your emotions, helping with irritability. I think of progesterone as our very kind of calming, inhibitory hormone that helps us relax. From a cardiovascular perspective, though, it does increase our healthy cholesterol, HDL. I always say H is our healthy. So it increases our good cholesterol and is very cardioprotective there. Sufficient levels also do help with hormonal headaches. We can get those headaches that fluctuate throughout the month as hormone level changes. And when we take progesterone orally, it actually does help with sleep. A topical cream does not help with sleep, but taken with an oral capsule, it does. And we can always do that in a slow release capsule. So it's kind of dispensed in your body throughout the night and helps with great sleep throughout the night. And progesterone will play a role in bone density as well. It is helpful for that too. Our hormones are always working together, right? Nothing just has one function that doesn't tie into all of the other hormones too. So there is a lot of overlap between the hormones and they're all working synergistically and working together for us, which is another reason why it's really important when we do hormone replacement therapy and bioidentical hormone replacement therapy that we're not just doing one hormone, that we're looking at everything in combination. So we're really mimicking how our natural levels should be and what our natural ratios should be too. So a hormone that we think of often as one of our male hormones is testosterone. Testosterone is something that we think about in terms of male hormones. We think about it with libido. We think about it with muscle building and ability to maintain muscle mass. We think about it with energy, motivation to exercise. So it is a really important hormone for women, just as it is for men. And with sex drive and libido, it will help that sex drive, and it does help the ability to climax and have orgasm. So it's something that I think really diminishes in women as well as men. And oftentimes it's not talked about as much. It's thought about as something just for men, which definitely is not true. We all have different levels of hormones. Women have testosterone, men have estrogen, there's crossover, and we all have varying amounts of the different hormones, but we still have all of those hormones in our bodies. Something that we think about hormonally, but is not grouped into the category of sex hormones like estrogen, progesterone, and testosterone is our thyroid hormone. So thyroid is a hormone that's very important, and those levels do diminish as we age as well. So thyroid really helps with a healthy metabolism. We see thyroid disorders more commonly in women than in men, but men can have them as well. But I would say fairly common in women in their 30s, 40s, 50s, and 60s that I see. Thyroid can impact our bad cholesterol, our LDL. L is our lousy cholesterol. So it can have an impact on that if it's not properly managed. And a lot of people notice when thyroid levels get low that they can experience weight gain, hair loss, dry skin, brittle nails. So the thyroid is something that's always really important to check throughout the lifetime as well. It's something I run on all my patients to make sure that we always have a baseline and that we're monitoring it efficiently. So one of the things that I love about hormones are that they're not only great for us to take internally, but we can use them externally too. And this is where I love Levita's line of hormone creams that they do for the skin. They have a whole skincare line that's done by prescription. So I'm actually going to turn it over to you, Deb, to give everybody a little bit of info about that, because it's one of my favorite products. And I think one of the most unique things that we see from Levita. I don't know another pharmacy that does this.
Yeah, thanks, doctor. Yes, one of the things that we're very proud of, my business partner, Chris, is a brilliant compounding pharmacist, and she loves healthy skin. So it's one of her passions. So from the time we opened, she spent a lot of time formulating the skin compounds. And so one of the exciting things about working with a physician like Dr. Cicerone and a pharmacist is, in pharmacy school, we learn about the triad, right? The patient, the physician, and the pharmacist. So working together with a physician like Dr. Cicerone and our pharmacist, they can basically pull together skincare that's personalized exclusively for you. So when you have prescription ingredients, the reason that they're far more superior than what you can get at Nordstrom's or over the counter is that as a pharmacy, we can use strengths and ingredients that you can't use in over the counter skincare products. And a good example of that is vitamin C. So vitamin C is something that's really good for your skin. But what we can do is we can use strengths and ingredients that you can't use. The other one is estradiol, which the doctor talked about earlier. There's actually clinically published studies that estradiol actually does more than just look at the appearance of fine lines and wrinkles. It actually reduces fine lines and wrinkles. And because estradiol is a prescription-only ingredient, you won't be able to get that in your skincare. So for someone who just celebrated their 64th birthday, I can tell you that this stuff works and that it's really important for your skin health. Sometimes we forget your skin's your largest organ, and it's an important thing to look at in your overall health too.
Absolutely. And I think, what's so important about that, Deb, too, is it can be done preventatively as well. And that's what I think is so important. One of the doctors at my practice, she's our skincare guru. She's 30 years old, and she does everything preventative you could ever imagine for her skin because she's seen the effects of aging. And so she's the one who's always giving me my skincare recommendations and really making sure that I do it too. But it is so important. These things can be done preventatively and they can be done to treat. And it really does change the makeup of your skin too. Again, it's not just about, putting on a cream that looks like it's filling in lines and wrinkles. It's about actually helping our bodies make that collagen, right? So that collagen fills and plumps and fills in those lines and wrinkles. So I think it's one of the most fantastic lines that I've seen in terms of skincare. We love it at our office.
Yeah, great.
So Deb, you talk about the compounding too, because you guys are such a unique pharmacy in terms of your accreditation and your abilities at the pharmacy.
Yeah, thanks, doctor. So yes, well, first of all, we're 100% women owned. So when it comes to talking about healthy aging for women, Chris and I are that demographic. And so we started it for personal reasons because we just felt like it was really important to have the education like we're doing today out there. But a lot of attention's being given to personalized medicine today. And what I like to say is Well, there's nothing more personalized than a compound because it's handmade for you specifically. It's not like something we pull off the shelf. Everything we compound is handmade. So when we talk about precise personalized medications by prescription only, you can only get a compound with a prescription from a doctor like Dr. Cicerone, who really understands how to prescribe these and is specifically trained in how to do that. So the reason that you would have a compound is so it's obviously personalized for you, your symptoms, your labs, but actually, you know, there are various routes and dosage forms and strengths that matter. So, you know, when you talk about thyroid is a really good example. You know, there are some really good thyroid commercial medications that you can get, but many times Dr. Cicerone will need to modify those and make sure that they're specifically personalized for you. The other point is Dr. Cicerone mentioned that we're PCAB accredited for both sterile and non-sterile compounding. It's something that we're incredibly proud of. Less than 1% of all the pharmacies in the United States are accredited. It's something that requires extra training, extra third-party testing, and a lot of extra equipment and different things that we need. It's something that we believe is super important. Dr. Cicerone is recommending that you take these prescriptions. You may be injecting these prescriptions. And so you really want to know that somebody is looking at and knowing that what you're taking is really of the highest quality and safety. So compounding is it's an art, and you just want to make sure that you're looking at the most safe and quality compounds that you can have. So one of the parts of being accredited is we can only use FDA approved chemical houses to buy our raw ingredients. So we purchase these raw ingredients from FDA approved clinical chemical houses. Even though, like for our bioidentical hormones, they're made of yam, they still come in raw powder, or what they're called raw chemicals. So even though they're plant-based, they still come from an FDA approved chemical house. And so to be accredited, you can only use those FDA approved sources. So there's a lot of reasons why you want to go to an accredited pharmacy. Of course, we'd love to have you come to us, but if you don't, make sure you go to an accredited pharmacy.
Absolutely. I mean, I think that's the important thing is, you know, you wouldn't grab your food out of a dumpster, right, and take it home and make groceries. You know, you want to make sure you're getting really good quality. You're putting it into you.
Right.
And it's the same with all of your medications and supplements as well.
Exactly.
You know, I always tell people, don't buy your supplements on Amazon. Nothing is regulated there. It can be a bottle with a similar label, and you don't know what's inside of it. So
Yes.
It's always important when we're taking things internally to make sure that it's made by a company that follows really strict manufacturing guidelines and that are morally and ethically sound as well. So all of these things that we're putting in, you know, you pay for what you get. And I think it's so important to make sure that you're getting everything from a really reputable and respected source too. And I think, you know, that's the beauty with the compounding pharmacies is, you know, Levita exists for their patients, really. You know, it's something that could be, you know, I could send everybody to Walgreens, and I could just say, well, you know, I can't really make you what you want, so just get the closest thing to it. But because Levita exists, we're able to give everyone exactly what they need. And Deb's example of thyroid is actually really great. You know, thyroid medication just comes in set dosages. So I can have maybe a patient, you know, cut a pill in half, you know, or take 1.5 pills, but it's really hard to get them the exact dosage they need if it's coming in, you know, increments of, you know, 10 or sometimes even 25 micrograms. Whereas with compounding, I can be so picky. They probably hate me, but I can be so picky. I can change things by 1 microgram, by 0.5 microgram if I want to. So I'm really able to give the patients exactly what they need, which is so important. Celine asked, can we transfer prescriptions to Levita? Absolutely, you can. And how long does hormone treatment usually take on average? Celine, can you give us a little more information? I'm not sure what you mean by that, in terms of how long does it take to get the medication, or how long are people usually on those medications?
Or once you start, Celine, like how long does it take before you feel the effect of the hormone replacement therapy program?
Yeah, send us a chat if you can clarify that, and we can come back to it for sure.
Yeah, once you start.
Oh, yes, once you start. Okay. I have patients that notice a difference within the first week or so, especially when they're bringing progesterone in for sleep. I have women that will put on that first dose of biased cream and feel their hot flashes diminish. So I would say it can be anywhere from a few days to about a week and a half or so. I'm not sure, Deb, what your other doctors are seeing, but that's pretty typical for us. And we always make sure too, once we start somebody on hormone replacement therapy, we always make sure in my practice that we're rechecking levels to make sure that everything is safe, that the doses are effective, and that we're not getting levels up too high. That typically doesn't happen because we're starting at a low dose and then increasing it only if needed. But we're always making sure that everyone is being monitored and that those levels are safe and it's working well for their bodies.
Yeah, so Vicki, Dr. Cicerone was reading your mind about checking your levels. That was great.
I check levels. I will say, in complete honesty and transparency, I am always going to be a little bit more of a conservative doctor. I'm always going to start people slow. I'm always going to check levels more often in the beginning to make sure that we're getting to a balanced place. So if I start somebody on bioidentical hormones, I'll check their levels again in about 7 to 8 weeks. I'll give them enough of their prescription to have for that 2-month mark, and I'll check right before that. We'll check those levels, make sure everything looks good. We'll do a check-in to make sure you're feeling good, because it's not just what it shows on the labs, right? It's how you're feeling. So you have your lab values, and then you have you as a person, and we have to make sure that those are on the same page too. And then once we get somebody who's, thyroid medication, we check about 6 weeks in. And then once we're set and we know that you're at a great dose and you're feeling good, I check labs 3 times a year, just to make sure that everything looks good. We do all of our prescriptions in about 4 to 5 month dispenses. So everyone has you're not coming back every month for it, just a few times a year to make sure that we're doing our due diligence as doctors and making sure that we're keeping you safe and healthy too. And thanks for the chat questions, you guys. I love having the engagement. I want to make sure everyone's getting their questions answered because that's what this is all about. Okay, let's do a quiz time because then you get to win some prizes. This is my favorite part.
That's right. So I think that as we go through here, if you could put your answers in the chat, that's how we'd like to do that. So that would be great. So take it away.
Perfect. Okay, so we'll start with question number 1. Okay, your midsection is getting bigger and you're gaining weight despite working out, eating a healthy diet. Which hormone is to blame? So number 1, high progesterone. Number 2, low estrogen. Number 3, estrogen dominance. Or 4, none of the above. Okay, so let's see what you guys say. Got a couple 3s, got a 2.
3, 4. This is good. So we got one of each almost.
Yeah, we're evenly spread through. Okay, so let's go. It's estrogen dominance. So you guys were right. So estrogen dominance is when there is a kind of imbalanced ratio of estrogen to progesterone. So when estrogen gets too high in comparison to progesterone, there's not enough progesterone, this is something that can happen. I actually see this a lot when patients come into me and they've gotten hormone replacement therapy from, a primary care doctor, a gynecologist that's just doing conventional hormones. They will only give them estrogen. They won't give them progesterone. And so women come in where their estrogen is very high and they think, well, I'm trying to take this estrogen to help with the weight gain and to help with the hot flashes. But without the progesterone there to balance, it's actually doing the opposite of what we want it to do. So take home from the majority of women, we always want to have combination estrogen and progesterone hormone replacement. Super important. Okay, next question. Okay, so you're happy 1 minute, irritable and annoyed the next. What could this be caused by besides your husband and your kids? So low progesterone, low estrogen, high testosterone, or none of the above. Let's see what you guys have to say in your chat. Vicky says number 1. Low progesterone. We're split again, 1, 2s, and 3s. Okay, so low progesterone. So low progesterone, like I was saying before, progesterone is kind of our inhibitory, calming, relaxing hormone. So when we don't have enough, it's easier to have a lot of those mood swings. So that's why I find progesterone so important for stabilizing mood, helping with healthy sleep patterns. We have women that are premenopausal that take progesterone and vary the dose during their cycle to kind of mimic their natural cycles, just to help and support a little bit. I have patients who are working with fertility and trying to get pregnant to take progesterone because it's so important for that too. So it has a bevy of different uses in the body, but definitely mood, calming, relaxing, stability is a big one of those. So you can't sleep, you can't fall asleep, you can't stay asleep. What's to blame? Low progesterone, high testosterone, low estrogen, or low progesterone and high testosterone. What do you guys think? This was me last night, tossing and turning like a crazy person.
Me too.
Yeah. My dogs were like, why are you up? It's 2 o'clock in the morning, Mom.
Yeah.
Okay. So like we've been saying, low progesterone plays such a huge role with our sleep. So super, super important as we age to make sure that we have those healthy protective progesterone levels as well. So this is our contact information for the clinic. I have 2 other naturopathic doctors that work at my clinic that specialize in hormones as well, Dr. Jennifer Zeglin and Dr. Christina Bradshaw. They're both absolutely wonderful, full of knowledge. We've all been working together for years. So make an appointment with any of us if you want to talk through this. We'll get you set up for your initial appointment. We'll talk through lab testing. We always do our initial appointment before we do any type of testing to make sure that we're testing the right things for each patient. So we'll do that. We'll get to know each other, and then we'll do our labs, and then we'll reconvene for a lab review. Barb, no, we don't take Medicare. We're a cash pay practice only. Naturopathic doctors are actually not covered by Medicare, unfortunately, which is my other hat besides being the medical director at Spark Health is I'm the president of the California Naturopathic Doctors Association. So we are and have been for years working diligently on trying to get both Medicare and commercial insurances to cover naturopathic medicine as preventive medicine. So the CNDA website is calnd.org, and they always have up-to-date legislation there as well.
Dr. Cicerone, does Medicare pay for the labs that are required?
It doesn't if ordered by a naturopathic doctor, because the naturopathic doctors aren't covered by Medicare,
Okay.
but we have really great cash pricing. So it's very, very minimal to do a hormone panel and look at that. So one of the labs that we use for our cash patients, sometimes it can be less than what a copay would be for insurance to do that. So yeah, really inexpensive. Vicky asked if one is on bioidentical for over 10 years, is it dangerous to stop them? I don't believe it's not dangerous to stop, but you want to make sure that depending on your age and your symptom picture, that you're tapering down appropriately. I would never just pull somebody off of hormones. I had a patient come into me once who had been seeing another doctor and was on really, really high levels of estrogen and had developed breast cancer. And even at that point, we still had to taper her down before she started treatment for breast cancer because we couldn't just yank those out of her system all at once. So it's not dangerous to stop them if it's done in the right way, but there are also ways to make sure that you can be taking it at very low doses for as long as your body needs it to. So it's not that you've been on it for a certain time, you have to be off it. It's really how the hormones are prescribed and how they're being monitored. Bianca, that would be, I can't speak to the cost. Deb, that would
Sure.
be.
Yeah. So normally it depends. We do take insurance. However, I will tell you that over the years, I've watched insurance create their copay for bioidentical hormones to be $40 to $45 or $50. So right now, like an average monthly dose of Biest, which is the estrogen Dr. Cicerone was talking about, is just under, it's like $39.95 for a 30-day dose. So roughly about $40 for the Biest, or the progesterone's about the same. So it really depends on what the physician and you believe that you really need. But if we do take insurance, again, the copay varies by insurance carrier.
And Barb asked, what is the oldest patient currently on this program? Well, gosh, I don't know what the pharmacy database looks like.
Yeah, I can tell you, we have, my 80-year-old mother is on bioidentical hormones as that. We do have other people, you know, in their 80s and 90s that do take the bioidentical hormones. Somebody asked this question one time of like, well, when do you stop taking bioidentical hormones? And someone answered, which would be my answer, well, as soon as you want to stop feeling, or you want to start feeling lousy. So again, like I had a hysterectomy, which is one of the reasons that we started La Vida. And so I know that bioidentical hormones and things like the B vitamin injections are really important for me and how I feel. So I don't ever see going off of them, just because I've had a hysterectomy, and so I need that extra help in making sure that they're produced.
Terry asked, what about an HMO? I can speak to the labs for an HMO. Typically, it's not covered. They don't have outside labs, outside lab coverage. So for some of my patients on an HMO, I'll give them a list of labs to request from their primary care doctor. And then the primary care doctor can run those. And if they can't run all of them, then we just kind of fill in the gaps with the things we can run it with cash pay, but again, very inexpensive cash pricing. And I don't believe an HMO would cover the compounded medications.
Yeah, normally HMOs don't. Many times, just exactly what you said, Dr. Cicerone, somebody might have Kaiser. I know I have the Scripps HMO, and I did exactly that. I asked for a hormone panel, had it run, and then you have it in your portal, so you can share it with Dr. Cicerone if you're an HMO, which actually the labs can, you know, end up being expensive if you're, you know, not getting insurance, or unless you have a relationship like Dr. Cicerone. So if your HMO will pay for the labs, that's a good way to do it.
And the other thing that I actually find is that a lot of flex spending accounts or health savings accounts will cover labs, they'll cover naturopathic doctor visits. I don't know, Deb, if you see that they cover compounds, but we have patients that have their HSA card on file with us, and that's what we use for their supplements, their labs, yep, everything, their appointments too.
Yes, the FSA and HSA cards are a great way to do that.
Yeah.
Well, that's a really good point. Thank you for bringing that up.
Bianco, the question to the workup panel of what your body needs. So if we were to do a hormone panel, let me see if I can actually get onto my desktop while we're doing this, and I can tell you. I'll search real quickly, and I will tell you what our hormone panel costs cash, just so you have it for a reference.
And Barb, we'll get to your question about how does wine affect hormones.
So a Spark female hormone panel, the cash price for that is $140 cash. With a PPO, it is $87, and that includes estrone and estradiol. Estrone is our icky form of estrogen we don't like. Our estradiol, our abundant form. Progesterone, FSH, and LH, which tell us where people are in that kind of, you know, premenopause, perimenopause, menopause shift. Our testosterone, both our free and total. Our sex hormone binding globulin, which binds up our hormones. Our precursor hormones, pregnenolone and DHEA sulfate, and then also cortisol. So $140 gets you all of those tests. So pretty good, yeah.
So Dr. Barb had a question about how wine affects
wine.
And I will say that through epigenetics and learning about methylation, I was shocked about once I methylated, I kind of became alcohol intolerant with red wine, but I'll let you answer it from a clinical standpoint.
Well, so that's, I mean, we could talk about this for probably the next hour, Barb, but it's a super complex question. I will say with alcohol, where I see it affecting hormones is actually more in our detox processes, like Deb was talking about. So when we have a higher detox burden, when our liver is more impacted, and we call it methylation, which are kind of, it's a fancy word for detox pathways. When that can get clogged up trying to detox other substances, whether it's alcohol, medications, too many supplements, it can affect how our hormones are actually detoxed as well. And so sometimes we can get hormones that are circulating for longer than they should be in the body, which, you know, for say, like that's estrogen, that could lead to a little bit higher levels of estrogen, or having that ratio of estrogen progesterone be off. From a non-sex hormone perspective, I would say wine absolutely affects our insulin and our blood sugar, which can trigger a cascade of effects. And insulin, when insulin is spiked up high, one of insulin's jobs besides managing blood sugar is to store fat. So that can be an impact of wine as well. I wouldn't say there's any type of wine that's preferable for less side effects. I think the main thing with any type of alcohol is just that it's done in moderation. You know, I would say no more than probably 2 glasses of wine a week is recommended. And if we're looking actually, you know, if we're just flipping the script a little bit and looking at any type of breast cancer, then I would say there is a lot of research showing that any type of alcohol consumption does increase the risk of recurrence after someone's been diagnosed with breast cancer. So we'd want to be super, super cautious about that.
Yeah, those are great questions, you guys. So thank you for asking them.
Anything else that we want to talk through? Any other questions?
Oh, that's good. They had some really good questions, Doctor.
Yeah.
That was great. Yeah, so it's good. So we've got some. Oh, is the test just for women? You know, that's a really good point, Bianca. We didn't talk about andropause.
Yeah, we have lots of men that come in for hormones as well, that are looking at testosterone replacement therapy as well. So no, we have different hormone panels for men and women, but definitely we have tons of men who come in with hormones and hormone concerns, and who are on testosterone replacement therapy too. So yeah, not just for women. Everyone benefits from healthy hormone levels.
You know, it's funny, we've had, when we've had some of these Wine, Women, and Hormone events in person, we've actually had husbands of the wives come and say, thank you, you saved our marriage. And then we have women say, you know, look, I feel so great. You know, I think maybe you've got that grumpy old man syndrome. You need to go see Dr. Cicerone too. Yeah.
Yep. Actually see tons of couples, tons of husbands and wives, tons of couples, because everyone wants to feel good. And I think, you know, the better that we feel, the better our relationships are with everybody in our world. So, you know, I always joke, my mom had me later in life. She had me, well, later in life for, you know, 42 years ago when she was 33. Which is fairly common now. So, you know, I hit puberty right when she hit menopause. So it was like the absolute worst timing ever. And I just always think, God, what if my mom had bioidentical hormones back then? You know, life would have been so much nicer as a teenage daughter.
Boy, isn't that the truth? Yes.
Totally. But yeah, everybody can use it. Everybody can benefit from it. Okay, Jean.
Controversy.
Loaded question. So I'm going to say, like, my opinion, my medical opinion. Look, you ask 10 different doctors a question, you will get 10 different opinions. Estrogen E1, estrone. Estrone is a very strong type of estrogen that typically goes down a very carcinogenic pathway. So I do not believe that there is any use for estrone or E1 in any type of hormone replacement therapy. Way back when, I mean, probably before I was even in school, doctors used to prescribe a tri-est cream with estrone, estradiol, and estriol. I have not seen that done in all of my time in the medical field. I have never seen that prescribed. So I don't believe that to be the case. I think it's actually putting patients at a higher risk for developing breast cancer. And I don't think there is any need for it at all when we're talking about bioidentical hormone replacement.
Yeah, and that's where it's interesting. There's three kinds of estrogen. As a layperson, it's E1, E2, and E3, right? And the estrone one, there's quite a lot of research, out there. So we have another question. My husband has to take thyroid medicine. Can compounds help get him off this medicine? Well,
so I wouldn't say, again, this is so hard to know. This is kind of a blanket statement. So without knowing your husband and knowing his medical history and his levels and his dosages, I'm just going to say in general, typically when people are on a thyroid medication, it's because the thyroid is not functioning as well as it could be. A compounded medication is it's the same medication, it's just done in a different form. And we can put both T4 and T3, both thyroid hormones in it, which typically when people are prescribed a thyroid medication, it's just T4, which then converts to T3. There are ways that we can look at lab values and modify dosages. And with the compounded medications, being able to give a little bit of T4, a little bit of T3, doing it in a slow release capsule if necessary. So it's used throughout the day a little bit better. That can help change dosages and make it a more effective type of thyroid medication. And then there are also different supplements that can help support the thyroid gland as well. So perhaps when people are taking those supplements, sometimes we can lower their dose of thyroid medication. But thyroid is something that it's very hard to manage, completely with lifestyle or supplements. So usually when people are on a thyroid medication, it is something that they tend to stay on. However, thyroid medication is probably one of the safest medications that somebody could be on long-term.
Yeah, and the key is, what was interesting, there's been a couple of times there's been a thyroid shortage. And so, there's Nature-Throid, West-Throid, and compounded versions, right? So it was really interesting when there was a shortage. Some patients found they did better on different types of thyroids. It was a very personal thing.
Yeah.
Yeah.
Vicki, why can some women live a long time and never take hormones? It's totally a choice.
Yep.
What works for one person is not necessarily what works for another. And I think, what I see in my practice every day, and Deb, you can probably speak to this too, is women have totally different experiences as they go through menopause. So I have some patients that say, I didn't even know it happened. I just stopped getting my period. I never had a hot flush, never had a night sweat. My sleep stayed perfect. My sex drive was great. They didn't need hormones. Their body felt fine without them. So for women like that, there can be, of course, like we were saying, the cardiovascular and bone density benefits of taking those hormones, but we can accomplish those things also non-hormonally too. I did my residency and fellowship in oncology. So I was used to working with women going through menopause who couldn't take hormones with a breast cancer diagnosis. So there are ways that we can accomplish a lot of those things too without hormones. But for, I would say, the majority of women, they do feel a little bit better with even just a very low dose of hormone replacement therapy. But not every woman needs it. We're all so individual. Some women never feel any symptoms of menopause and they just choose not to be on it. Or if some women have a very strong family history of breast cancer or a personal history of breast cancer, then they wouldn't take hormones.
Yeah, your body's a symphony, right? And everyone plays their own tune. So it's a very personal experience.
Yeah.
Oh. Fatigue.
Okay, sorry. So I'm just going back to the hormones. So if we've been on hormones and gets breast cancer, she would need to get off of them. So it, again, comes down to opinions. In my opinion, yes. If the breast cancer is a hormone positive cancer, meaning those breast cancer cells have estrogen and progesterone receptors on them, and those hormones can be encouraging that cancer cell growth and proliferation, then yes, you would remove those hormones as sources to be very safe. Again, there is research. There is a doctor out of New York who I've studied with, who he believes that the risk of a breast cancer recurrence or any risk of hormones with breast cancer is actually secondary to risk of cardiovascular events from low estrogen. So he, has done studies all of the research and conducts research and trials on his own, saying that even with breast cancer, the cardiovascular benefits of estrogen replacement therapy outweigh the risk of breast cancer. His personal preference. For me, with my oncology training, and working with women with breast cancer, my feeling is in order to reduce the risk of recurrence, move women off those hormones and find non-hormonal ways to deal with all of those things. But again, my opinion.
Dr. Cicerone, does that include testosterone and progesterone?
It depends, and this comes down to having a really good care team around you. So because testosterone can convert to estrogen, and then there can be some cancers that are progesterone receptor positive too. It really just depends on the percentages of estrogen receptor and progesterone receptor positivity, and what medical oncologists and patients feel comfortable with. So, if that's the case, I always like to have a kind of a roundtable with the medical oncologist who's treating the patient, myself, so we can actually talk through this and see what everybody's comfortable with.
Right.
Some are fine with it, and some say no. So it's just what we feel good about moving forward.
So Jeannie has a question about, can overdoing any hormone cause fatigue?
It could. I mean, look, progesterone is very calming. It's very relaxing. And so if somebody was on a very high dose of progesterone in a slow release capsule that they were taking before bedtime, that could cause morning grogginess for some women. Again, when the hormone levels in your body are balanced, when the hormone dosage that you're getting is appropriate, I don't see that happen very frequently.
Great, good. Again, great questions. Those are very good. Many times your hormone levels being off can make you fatigued, tired of being
Absolutely.
tired. It's something. So sometimes you may be taking hormones, but that's an important reason to get checked and have your levels redone, is they may be off and you just need to tweak them.
Absolutely.
Yeah. All right, great. Well, if there aren't any more questions, I think that you've got, I think the next slide, does that have your information, or the last slide had your information about booking?
Yep, last slide did. Yep.
Okay, great. So I think you're offering anybody who was on here today a really good deal as far as coming to see you. Did you want to talk about that, Doctor?
Sure. So I think I think Helena was going to do a raffle also and do a free, are we doing that, Helena? I believe we're going to do a raffle for a free initial appointment at Spark Health. That was one of them too. And then if you have any questions, just reach out, let me know. Feel free to call the office, feel free to call the pharmacy. If you have questions about, any hormone replacement therapy, any bioidentical questions, or any questions about kind of the process, just reach out and let us know. Both Deb and I have great office staff that are super well versed in everything hormone. So they can lead you through and get you set up with a time to talk to us if need be too.
Yeah, you're not alone. I hope after today you realize that, you're not alone. You're not crazy. We're here to help you. So there's no need to suffer. Relief is on the way. And so what we'll do is we'll get back to everybody that was on here with the winner. Helena's going to go ahead and do the raffle. I think she's having a hard time with some technical issues now, but we also want to thank our co-sponsor, Koi Zen. A really wonderful co-sponsor to help us out here and getting the word out. Just always want to say thank you for that as well.
Yes, absolutely.
Deb, can you hear me?
Oh, there you go, Helena. Yeah, go ahead. Did you want to talk about spinning the numbers here for Dr. Cicerone?
Yes, and I believe a few had dropped off, but I'm going to spin the wheel.
Okay.
All right. And the winner is Melody Easter.
Oh, good.
Yes. And Melody is still on, correct?
Yes, she's there. Great. Congratulations, Melody.
Congratulations, Melody. And this is going to be for a La Vita face mask.
Okay, yep, I don't know if you can see me, but yes, it's a beautiful face mask. I love them.
Yes. And I'm going to spin another winner. And this is for the Lavita visor.
Visor.
We have Barbara Normington. Congratulations.
Yeah,
All
good. I
right.
don't know if Barb's still on, but we'll make sure Barb gets it. And so, and the last one is for Dr. Cicerone's visit. Is that
Yes.
right?
This will be the grand prize.
The grand prize.
Yay. Okay, I'm gonna spin the wheel right now. Wow, is Vicky still on? Congratulations, Vicky Chin.
Vicky, all right. Fantastic. Congratulations. Did you want to explain what that is, Helena? The grand prize?
This is for a 60 minutes initial consultation with either Dr. Cicerone or any doctors at Spark. And yeah, so just, let us know when you wanted to set up for the appointment, the initial appointment.
Yeah,
Just
thank
call
you,
the
doctor.
office.
That's very generous. Super
Of
generous.
course. Yeah, just
Yes.
call the office and the girls will get you scheduled.
That's great.
Great.
All right, ladies. Well, thank you so much. Congratulations to the winners, and Dr. Cicerone and Zen Koi, thank you so much for helping us make this event happen. And we look forward to doing it again next time.
Absolutely. Thanks, everyone. It was so great.
All right, doctor. Thank you so much. We appreciate it.
Of course. Bye.
Bye-bye.
Bye-bye.